So for those of you who may not be aware, the Open Wide Foundation is our nonprofit arm of SPEAR. And so there are so many of you in this room that are participants and donors to the Open Wide Foundation. We're going to celebrate you in just a minute, but I wanted to kind of give an update as to where we are with this organization. So the Open Wide Foundation started with the idea that there is a community need in a given area, high caries rate and low access to care, that we then partner with the local community to garner local support so that it's sustainable over time, and then we get to build it for the future and then completely turn it over to the people in that area within 5 years. So the Open Wide Foundation began in 2012. It began in 2012 with the generosity of Imtiaz Kaleem and Rezwan Manji, with the generosity of Frank and Charlene Spear, with the generosity of Glenn and Lisa Weisel, and the board of Spear Education at the time. And so when we launched Spear Online, we went and looked to you all to end up supporting the Open Wide Foundation as it relates to your effort and your support. And in 2013, phase 2 began, where we started to provide basic restorative care. Then phase 3 in 2015 was when advanced restorative care was provided. And then phase 4, which I'm really excited to share with you, the transition of the clinic over to the community. And throughout this process, what has been developed for all of you is an easy way to get involved with an online platform, which, trust me, takes a lot of effort, time, and resources to be able to give you the opportunity to go online, see if it's something you're interested, sign up, and then follow your travel itinerary from there. So where we are today is wonderful news. What I want to share with you is where we are with the clinics, some initiatives that have gone on, and some footprints that we've made in the world. So I'm excited to report to you that the first 5-year Open Wide community model is complete. The first community clinic, the first model clinic in Peronia, Guatemala, was established in 2012, and it was selected because of the high caries rate and the low access to care. And we have had such an outpouring of support from so many of you in this room, and the numbers continue to grow in terms of your volunteerism throughout the years. This is actually a shot of the model clinic in 2017 in Peronia, which is now completely self-administered by the local community. So what ended up happening after this community was established is that we ended up seeing the birth of additional satellite clinics around the country of Guatemala that were completely self-sustaining from the very beginning, which is an amazing thing if you think about it. What we ended up seeing was 5 public dental clinics that started with Open Wide's support, and they received the equipment from individual donations. The care was provided by dental resident students placed from the university. Hands-on training was, of course, offered in Peronia, and for not only the dentists but the support staff. And I want you to understand that the costs of their respective clinics were completely covered, and they were self-sustaining from day one because of the work that was done in the model clinic in Peronia. Now, one of those satellite clinics I'm getting ahead of myself. I'm so excited. So in 2016, we actually partnered with a local charity in Guatemala, Build a Smile, and the Dr. Miguel Valdez actually provided a 4-operatory clinic, and this clinic is providing CEREC restorations, and the hands-on training was provided by Open Wide, and the local dentists are placing implant restorations for the underserved through the support of Open Wide. So what I was so excited about to share with you was the clinic in San Pedro that actually started as a satellite clinic that was in an incredibly rural area that served a 95% Mayan population, that had the same distance from the city of Antigua as the clinic in Peronia. What ended up happening was that opened as a satellite in 2014, but what was unique about it was that it was attached to a medical clinic. And so what ended up happening was there was so much support that was garnered, they actually put a bus stop right in front of the dental and medical clinics, because although it's on an incredibly rural area, the road in which it's on is actually served by 1 million people. So what ended up happening was in 2018, the clinic was actually remodeled, and it became one of our model clinics. First started as a satellite and then transitioned over to a model clinic. And there you see MTIA's this year celebrating the remodel of the San Pedro Clinic with 5 new ADEC chairs that were donated. So it's been an incredible effort and has incredible support by the people of Guatemala. If that wasn't enough, what we've also seen is national public education that has gone forward with a campaign to increase awareness for oral care, awareness for oral hygiene, awareness for oral health. There has been an initiative, a caries prevention pilot that has been conducted that has used silver nitrate and fluoride varnish to actually arrest the caries so that these children can then get follow-up care later. But what we're looking to do is identify the caries, arrest the caries, and then follow through. And last but not least, from an initiative perspective in the community, there's been a great local school outreach program for oral checks, fluoride washes, as well as just awareness of oral health and oral care. So one of the things that I would love to celebrate with you is the reality that over the last several years, 2 manuals have been authored that together, the clinical manual and the administrative manual together of over 1,000 pages, that's with, multiple zeros, has been created so that these satellite clinics can open from day one to be self-administered with guidance of these manuals. And these manuals have actually been used as frameworks and models for actually to open up medical clinics using these model manuals as a framework for them to use to then open clinics moving forward. And I'd absolutely be remiss if I didn't recognize Charity Burtonshaw, who is the executive director of the Open Wide Foundation, who will be here over the next couple days, who has really fostered and led the initiative to have these clinic manuals created so that we can continue to spread oral health within the country of Guatemala, within the model as well as the satellite clinics. The last thing I wanted to share with you before we do our celebration is the reality that over the last 3 years, the Open Wide Foundation has received $120,000 as an educational grant from Google. And what that educational grant is used for is ads. So for those of you who have websites and those of you who are always trying to get your practices up in the hierarchy when you search, that's what this grant has been used for. And to date, if you go in and start to search on dental charity missions, etc., we've shown 1,178,095 ads through the support and generosity of Google to help support the people in Guatemala that those clinics are serving. Last but not least, there's an individual I wanted to recognize, which is Dr. Michael Johnson. Dr. Michael Johnson is a Spear Faculty Club member, study club leader. He's a member of the visiting faculty. And Mike and I share something in common, which is we both had to give up clinical practice before we were ready. And Michael and I had a conversation when he was considering having to retire from clinical practice because it's something I went through as well. And what Michael has done is taken what some people would look as a disablement and turned it into ablement. And so he is now the clinical director for the Open Wide Foundation. He teaches at AT Still, and he gives great contributions to us here at Spirit Education. So I wanted to recognize Dr. Michael Johnson. So last but not least, if I could have the house lights up for just a moment, could I please have the honor of having all the Open Wide donors and participants please rise to be recognized by your peers. So I really appreciate your attention and your patience. That was a lot to go over, and the Open Wide Foundation is making such a difference in people's lives. It's a little challenging to update you all of the good works that have been done in 5 to 10 minutes, but I appreciate your attention.